Hi, my name's Phil. I'd like to talk about politics. In this video, I'd like to discuss why it is that an ordinary delivery company in the UK is able to get hold of 100,000 test kits for use on its staff, but the NHS staff are still not being routinely tested. But first, if you'd like to be notified of daily news and politics, then please subscribe to the channel and click the bell notification icon. So the way to beat this pandemic has been known for a while. Part of the solution is to test, and test again. It's simple enough. If you are routinely testing people, as many people as possible, you can track the spread of the virus and then easily isolate it, or at least more easily isolate it. Take Germany as a close example. We talked about South Korea quite a lot. They've been doing a fantastic job. But even Germany, closer to home, are testing 500,000 people a day, and as a result are seeing a much fewer deaths than comparable nations. Without testing, you have no idea how the virus is spreading, where the hotspots are. You don't know anything about it. In fact, it's not even like we can track deaths in the UK, because if people die of the virus at home, that isn't being counted on the statistics because there's no testing there, so they don't actually know what it is that killed them. So not only are the number of cases in the UK only a tiny fraction of the real number, and the government are not trying to suggest otherwise with that. I said, yeah, the real number's way, way higher. We've got no idea. Even the number of deaths is not accurate. But at the very least, what you do need to do is test those most at risk of contracting and spreading the virus. That is, people who have to come into contact with others as part of their key work. That, of course, has to include NHS staff. Now, a lot is being made of getting frontline NHS staff tested, but it actually has to be all of them, because the frontline NHS staff work with the ones who are not frontline NHS staff as well, people in admin and so on. They're coming into contact with them. The capacity to spread the virus exists there as well. So it has to be all of them. It really should include anyone who goes into a hospital or a clinic for whatever reason. You know, frontline staff work with others in the NHS. They come into contact with others in the NHS. So the spread of a virus is a huge risk there. But even frontline staff are not being tested properly. You know, some of you may think, well, they are. The government said so. No, they're not. At the time I'm doing this, there were supposed to be 10,000 tests a day that aim for the UK government. But a health minister has had to admit that in actual fact, there's only 7,000 were actually tested. But, you know, what we meant was there's a capacity to test 10,000 a day. So why are we testing below the capacity? We should be testing as many as possible. Why is it below? And that says nothing of the fact that why is our capacity only 10,000? It's not like it would all be okay if we had have tested 10,000. Germany's testing 500,000 a day. Why is our capacity only 10,000, a 50th? 2% of Germany's. And Germany's been doing this for a while. And I've heard all sorts of nonsense concerning this. First of all, it was, oh, we can't get the test kits. And then, when that became nonsense, it was, oh, yeah, we could get the test kits, but, you know, labs can only process so many tests, can't they? Don't matter how many tests we've got if the labs can only go at a certain rate. And it's the sort of thing that might sound reasonable to someone not versed in science or who doesn't look at other countries, neither of which applies to me. I know that the equipment and expertise needed for this is in university labs up and down the country. If it came to that, it wouldn't come to that because our normal capacity is much greater than people imagine. And I also know, by looking at other countries, that we can test much more than we are because other comparable countries are doing so. I mean, like I said, literally 50 times as many in Germany as in the UK. What is that about? Germany doesn't have much larger population than us. And you know, and then I see the news. Let's put the tin hat on it. I see the news that a food delivery service, Ocado, has bought 100,000 test kits so that it can test its delivery drivers and other staff in order to protect both their workforce and the general public from the virus. So we know that there's no issue with obtaining test kits for NHS staff, other than the fact that the governments don't want to do it. I mean, we knew that already because the government has, it might not be buying PPE and ventilators, but it has bought test kits. It's bought millions of them, in fact. They're just not using them. They're hoarding them. They've panic bought the test kits, but not actually using them. They're a bit like some people around this country who've got a spare room full of test kits, just like some people have got. They've put into the youngest kids' room mountains of toilet rolls. So not only are we risking spreading the virus, because a hospital that is not routinely testing is going to be an absolute hotbed for this. Absolute hotbed for it. But it is completely self-defeating. We already have too few doctors and nurses on the NHS. That was before this crisis. There were already too few, by tens of thousands. This crisis has now put extra load on the system because there's much more demand for healthcare services now. And that healthcare was already not coping. Yes, it's all right, Boris Johnson saying this would break any healthcare system in the world. Absolutely. We could see that from Italy. If your cases are getting out of control, yeah, there's no doubt about it. Even if the NHS were coping before, it would be struggling very soon now. But it wasn't coping before. That is the key point. So it already wasn't coping. Then what happens is you add in a policy that means that healthy NHS medics can't go to work because someone in their household develops a bit of a cough, then they have to self-isolate. And bear in mind, quite a few medics, actually, particularly younger ones, live with other medics. They house share with other medics. Paramedics, doctors, nurses, stuff like that tend to house share. So you wipe out, for one person getting a bit of a cough, which is probably just a cough, you can wipe out half a dozen, and this has been happening, half a dozen medics who have to self-isolate. And, because they're not being tested. And then you stretch the service even more because there's now fewer people going to work. Then cause actual contraction of the virus. So we're not now talking about people who've probably just got a cough and the rest of the household has to stay in. No, now we're talking about NHS medics actually contracting the virus because you're not monitoring it, and hospitals and clinics are going to be where we see the biggest spread in this if we're not doing that. Then you reduce the number of medics still further. We've already had some die of this. And it's one thing if you're doing all you can. That's a tragedy, if you're doing all you can. But when we're not doing our best, when we could do more and we're just choosing not to, a political decision not to, then it moves from a tragedy to, frankly, an act of deep immorality. But that's the situation we're in now. This is why I would say when the government announced something that sounds like it's getting onto the right path, I think, well, okay, good, better late than never. But I always now need to wait for it to actually be done. I'm not interested in the government saying they're going to test NHS staff until they're actually doing it, and they are not actually doing it at the moment. I'm not buying it. That's my view anyway. Let me know yours in the comments below. Hope you found the video interesting. If you did, don't forget to click the like button. And if you'd like to support the channel further, then please also click the Patreon link for details. And until next time, I'll see you later.